I'd like to talk to you about using cannabis, or marijuana as many people call it, as a medicine. I'd like you to understand that this plant has been used as a medicine for thousands of years. And in the history of mankind, no one has ever died from its use. It is a very, very safe plant to use. Some of you are concerned about the addictive potential of cannabis, and I'd like you to understand that all the literature that's been published that talks about dangers of marijuana use were published in the adolescent literature. And those studies showed that when teenagers used high doses of cannabis on a regular basis, they had an increased risk of addiction and addiction to other substances as well as an increased risk of psychosis and other psychological problems. And that information is true, and we all appreciate that. But that study is also true for teenagers who use alcohol or prescription drugs, especially prescription painkillers. And what we need to understand and take away from that literature is the fact that the adolescent brain is still developing, and it continues to develop into the early 20s. And when those children expose themselves to these foreign chemicals, it does cause chemical changes in the brain that can lead to some negative outcomes. But I want you to know that there has been no data to date that shows that cannabis, especially when used as a medicine, causes any kind of addiction in adults. And as a matter of fact, in some of the more progressive rehabilitation facilities, especially out on the West Coast, they're using cannabis as a therapy to treat patients with addiction disorders.